Welcome back to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning, real treat, Dr. Jeffrey Osborne. How are you, doctor?
I'm doing fantastic. How are you?
I'm doing so well. So glad you're here. This is a very important topic. We are talking today about staying active without getting injured. Now, you are part of the sports medicine and orthopedic teams at Covenant Medical Group. So can you tell us a little bit about what you do and who you help in your practice?
Absolutely. From a sports medicine side, we help take care of athletes and patients of any age group who have injuries to their tendons or ligaments that's preventing them from being active and can help get them back to their prior level activity. We also take care of people with broken bones, take care of people that have wear and tear of their joints and maybe need a replacement of their knee, hip, or shoulder. So kind of everything across the board.
Now you said shoulder replacement. Why would someone need a shoulder replacement?
Well, there's two main reasons that someone might need a shoulder replacement. The first would be if they have arthritis, or in other words, the lining of their joint has worn away so that the fluid motion has kind of decreased and they lose function and pain. And then the other would be someone that has a massive tear in their rotator cuff, which are the muscles that stabilize the shoulder joint. And if it's not fixable, shoulder replacement can be an option to help improve their function and pain.
Now, I know a lot of people like to shy away from surgery, so what options do folks have to help with the pain and function while avoiding surgery, doctor?
It's a great question. We always like to start with more conservative management if we can. Simple things like over-the-counter medications that help to decrease inflammation, as well as topical creams can sometimes give pain relief. If those things aren't working, we can also do things like injections with a steroid medication to the shoulder, which often gives people good relief. And just trying to keep the joint mobile and prevent it from getting stiff, can really help with maintaining function while avoiding surgery. Okay,
so I have a question for you, doctor. I have heard something about the reverse shoulder replacement. What is that about?
So it quite literally is just reversing the alignment of the joint. So a new socket goes on the ball side and the ball goes on the socket side. And like we mentioned earlier, for patients with the large rotator cuff tears, simply put, it basically just changes the mechanics of how the shoulder functions to allow it to operate without needing your rotator cuff. And so that's specifically designed for those patients that have a irreparable rotator cuff tear to allow their shoulder to improve function, get better pain, get better range of motion.
So with these options, how's the recovery time for shoulder replacement?
Most patients are usually going to be in a sling for about 4 to 6 weeks while the initial healing phase goes. And then we'll do physical therapy to help really get them moving and going again. And I would say about 3 months after the surgery, most patients are about 90% recovered and getting back to using the arm and getting back to their daily activities.
Well, anything else you'd like to tell people out there that they may want to know when it comes to shoulder replacement or what you do?
Yeah, absolutely. I mean, from a shoulder replacement standpoint, we're happy to see anyone at any time. And kind of work toward, surgery if they need it. And I think anytime we're getting to the summer months, hopefully people are outside, being active, having a good time. But if, just as a reminder, that Covenant does have a sports medicine hotline. So if you or anyone you know has an injury and has a question, when you go to the emergency room, what should I do? You can give us a call. We're available 7 days a week, get connected directly with a physician, and they can kind of give real-time guidance on what to do, as well as help get you into our office to be seen more quickly. And that's 989-583-SPRT.
Sounds good. Doctor, as a mom, I have to ask you for all the moms out there and all the parents. We have our kids out now. We're outside now with summertime. What types of tips do you have for prevention of just some typical injuries that you see?
Yeah, a couple of things would be, making sure that, you're being careful if you're up on jungle gyms and heights, with falling and things like that. Make sure you're wearing a helmet or wrist guards or appropriate protective gear if you're going to be on a bike or a skateboard. And with the heat, obviously, where it's been really hot and humid here in Michigan, making sure you're staying hydrated, finding time for breaks in the shade, avoiding direct sunlight during the main hours of the day so you're not getting overheated.
I love those, doctor. Okay, kids out there, my kids especially, you hear them? Everyone, wear a helmet if you're doing this. Thank you so much. Appreciate you, doctor. Great advice. And thank you for being with us today. If you have any additional information that you'd like about today's topic, just head on over to the hot links page at WNEM.com.